Well, I think the population that we are seeing for patients and clients are very complex, they're very acute, they're vulnerable, they are either unhoused or precariously housed. So I think the demand requires us to be compassionate, requires us to be empathetic, and to provide that approach consistently, because our patients that are requiring our services really need that kind of care in order for them to receive and be receptive to our services. It's hard to predict what the next 5 to 10 years will be like. However, I do think that healthcare, as always, needs to be flexible and adaptable to the needs of the changing population, the changing environment and landscape of healthcare.
I'm working here. I've worked here for nearly 24 years. There are some amazing colleagues I have, amazing allied staff, amazing nurses we have. And these people are really dedicated to their patients. The demand for care for seniors is going to only rapidly increase in the future. Our population numbers are going up significantly in Fraser Health. Plus, the multiple comorbid conditions in seniors makes them quite an interesting group to treat, quite a challenging group to treat. So the demand for geriatric psychiatrists and all staff dealing with geriatric psychiatry issues is only going to rapidly increase.
I see patients who are struggling with mental health challenges throughout pregnancy and following birth. I would strongly encourage you to think about giving to the RCH Foundation. This population we work with is a vulnerable population. I see, when individuals do get the services they need, they do better, their babies do better, their families do better, and the community as a whole does better.
So we developed new services, we expanded the old services, we have this brand new building, we more than doubled the staff, including the psychiatrists. And so I'm really proud of how we've grown and adapted and developed, but I also am really proud of how we've maintained this really good culture we have here. I think the population has grown, the need for mental health services has grown. They need more access to mental health services, so I guess keeping up with that demand has been tough. We want to help everybody, we want to create more services, we want to have shorter wait lists, we want to be able to help people as soon as they need help, and so and we have made a lot of progress in doing that, but I think that's the toughest thing. There's always a lot of pressure to help people faster and do better, and we just naturally want to do better all the time.